Hello everyone and welcome again to my weekly video update. My name is Naveen Agarwal and this video is part of my series on ISO 14971 2019 revision. Now ISO 14971 went through a major revision in 2019, so there are significant changes and I've talked about some of those key changes in another video. You can find that video on my YouTube channel. In this video, I want to talk about risk analysis, which is one of the requirements of ISO 14971 and is a very important part of the whole risk management process. I will also discuss one of the tools you can use for risk analysis. It's called the PHA, or a preliminary hazard analysis. Now there is no requirement, it's not mandatory to use a PHA, but it is a best practice, and if done right, a PHA can be a very effective tool for you. So if you're already using a PHA, hopefully this video will give you some new ideas and spark some new thoughts. And if not, you can look at these examples that I'm going to provide and maybe start working on developing a PHA for your risk analysis. It's a very high level description. If you have any questions, further details, just send me an email or drop me a comment. I will consider that for future videos. So let's dig right into it. As I mentioned before, risk analysis is a requirement of the standard. Specifically, the manufacturer shall perform risk analysis for the particular medical device as described in clauses 5.2 through 5.5. Now, there are four key elements of the risk analysis. You have to think about intended use and reasonably foreseeable misuse to start with, because risk analysis is performed in the context of that. Characteristics related to safety have to be outlined. Hazards and hazardous situations and potential harms have to be listed. And finally, risks have to be estimated. In this particular video, I'm going to focus on hazards and hazardous situation because that is what the focus of PHA is. But let's understand some basic terms. First, what is a hazard? Hazard is a potential source of harm. Now let's take an example which is very relevant in today's time because we are all worried about COVID-19. Let's say a surface is contaminated with bacteria or virus or any other biological contamination. That is a biological hazard. It's a potential source of harm. A hazardous situation is a circumstance in which people, property, or the environment are exposed to one or more hazards. So in this particular case, if a person is potentially infected and by mistake you shake their hand, there is a chance that the infection may spread from them to you on your hands. So that's a hazardous situation. Finally, a harm. Hazardous situation may result in a harm, different harms of different severities. Harm is an injury or damage to the health of people or damage to property or the environment. So in this particular case, you could catch an infection, or it may be some cold or maybe a mild flu now that the flu season is going to start. Or in a more serious situation, you might catch COVID, which is unfortunate, but it can happen. And even if you catch COVID, it might result into different severities of different harms. Maybe you recover soon, or maybe you have to go to the hospital. So there's a cascade of events that take place and different harms can happen. So there is a linkage between hazards, hazardous situations, and harms. And it's important to understand that link. Usually there's a trigger event. That trigger event leads to a sequence of events, almost like a set of dominoes falling. Those sequence of events lead to a hazardous situation, and that hazardous situation may lead to a harm. So you could do your analysis from what I call a bottom-up approach, meaning starting from the trigger event, look at sequence of events, hazardous situations, and then to harm. Or you could do top-down, which is starting from the harm, thinking about what hazardous situations could lead to that harm, what sequence of events could lead to that hazardous situation, and what could be a trigger event for that sequence of events. So you could do a bottom-up analysis or a top-down analysis, and it's best done iteratively. So you start bottom-up, go build all the way to the top, or you go back down and do back and forth. So it's best to do it iteratively together, one after the other. Okay. So let's look at the PHA. PHA is an inductive method of analysis. And what it means is basically you are starting from a set of data or observations or experience about some events that may happen as a result of some sequence of events. So you're not starting with a hypothesis or a theory already. You are starting with some experience and data, and you're building up. So PHA is done early in the design development phase. You can start as a baseline a PHA of a similar device that you might have done in the past, because many of the things could be similar. You have to focus on the differences to outline some additional hazards and hazardous situations as appropriate. Okay, now what you're trying to do is analyzing the potential effects of different factors such as materials of construction, components used, the interfaces of those components. High-level operating principle: is it a chemical action or electrical action or a mechanical action that results into the therapeutic benefit? Very high level. Use environment and other factors. It could be one or two factors or multiple factors. You have to look at the system as a whole. So what does it consist of? It consists of the following elements: hazards, sequence of events, and hazardous situations. Potential harms, probability and severity of those harms, and identification of potential control measures. Remember, it's potential. You are starting early on. It's almost like your opportunity to outline what potential control measures could be implemented, and you could prioritize them. So it's a potential list as of now. Okay, let's take an example. And we are living through the time of COVID, so I'll use the example of a face mask. A face mask is used to stop the transmission of this disease from a potentially infected person. So in some cases, it could be actually a medical device. Hazard category. We're going to look at a hazard category, just a physical, very simple scenario. And this is only one line item in a PHA. Okay. We are looking at hazard type as a shape and geometry of this mask. Foreseeable sequence of events. We're going to think about a situation where prolonged use of a very tight fitting mask leads to skin irritation. User experiences minor discomfort such as itchiness, but they are able to replace it before things get worse and they may have more complicated skin reaction. Harm is itching. Severity, you may have a scale, maybe 1 to 5 scale. I just took an example of 2 because it's a minor issue and it could be reversible. There is no permanent damage. Probability of occurrence of harm, again, you may have 1 or more levels, occasional, maybe some frequency, some rate that you can come up with, some quantification, and maybe it's happening occasionally. Potential risk controls you may consider are the design. For example, the size range, the dimensions, the material of construction, their softness, the surface roughness, the elastic ear loop, the tension in that loop sometimes can even cause pain and irritation behind the ear. So you have to think about that. How about when the mask is made? There should be clean room conditions, some clean environment, because some contamination can go on the mask and may irritate the user. Then finally, you can also consider use instructions and warnings. So a variety of controls can be considered for a simple thing like that. Now, this is only one simple example. You may have hundreds of line items in our PHA based on the complexity and the risk of the device that you are thinking about. Okay, so we went through a lot. Risk analysis is quite complicated. It involves 4 key steps: identification of intended use, foreseeable misuse, thinking about characteristics related to safety, hazardous situations and harms, and estimation of the risk. In particular, we focused on the PHA, which looks at hazards and hazardous situations. And we gave one simple example of a mask. So you have to basically look at it as a very structured, disciplined activity, and it's best done in a cross-functional setting. So I hope this is useful, but if you have any further questions, send me a note and I will consider making videos about those specific questions to dig more into details. I hope all of you are staying safe in this difficult time, and I want to thank you for your interest and attention.